Thanks for the invitation to do this webinar, and hopefully it will be of help. Just a quick conflict of interest slide to say that Vary and I are both funded by the UK Medical Research Council and Scottish Government Chief Scientist Office. And this work that we're reporting on was funded by the Cochrane Strategic Methods Fund, originally called ICONS Quant, and now known as SWIM. And also I'm joint coordinating editor with Cochrane Public Health and work with the Complex Review Support Unit. But I don't think there's anything else we should be declaring. So what we're going to do is do a quick recap of webinar 1, and then we're just really going to go through the items that are included in the SWIM reporting guideline. For some of you might have attended the first webinar way back in February, and we had hoped that this one would follow about a month afterwards, but industrial action and COVID just put paid to that. So just as a recap, that webinar was really focusing on issues in narrative synthesis and just trying to get a bit of discussion and thought going about what do we mean by narrative synthesis. And we often refer to it as the Cinderella of systematic review methods. And the reason we say that is because it's used very often, so it does a lot of work, but yet people don't really talk about it very much. And it's not very well treated. It's treated as if it's a bit of a dirty secret. And one of the main problems we've found when we've been looking at narrative synthesis is that it's very poorly reported. And very often, the most that you will get in terms of what the methods that are reported for narrative synthesis is a statement that says the data were heterogeneous, so the data were synthesized narratively. But that doesn't really tell you very much. In fact, it doesn't really tell you anything at all. So the big issue with poor reporting, and when we've been doing work on this, we've not found a very good, clear definition of what narrative synthesis is, very little guidance on how you conduct narrative synthesis, and that makes you wonder, really, does it fit within the systematic review sort of approach to synthesis and reviewing evidence when the whole underpinning principle of systematic review is to apply a scientific and transparent approach to synthesizing of evidence, and narrative synthesis doesn't seem to fit within that. And so that's what led us on to the work on SWIM. So just to keep the sort of SWIM metaphor going, we're trying to say, you know, don't be too disheartened or don't feel the heart sink of narrative synthesis. Reach out and swim. And so from this work, we published the reporting guideline for SWIM in the BMJ at the start of this year. And just to make sure you're clear, the scope of SWIM and this reporting guideline is for the quantitative intervention effect data, where meta-analysis of standardized effect sizes are not used. So there's lots of other applications of narrative synthesis that maybe need more exploration, how you, like for example, how you synthesize qualitative data, but this SWIM reporting guideline is specific for quantitative intervention effect data. The SWIM reporting guideline is very closely aligned with conduct guidance that's been published in the most recent version of the Cochrane Handbook, led by, and the particular chapter is led by Joe McKenzie and Sue Brennan. And I'd just like to also say, you know, this is not the last word about narrative synthesis. In fact, I think this is maybe just part of the start to try and help authors and readers and editors be a bit clearer what to do when they can't do a meta-analysis. So the aim of the reporting guidelines is to improve transparent reporting. It's not about conduct guidance, because the conduct guidance is in the handbook or other areas, other sources. It's also, the SWIM reporting guideline is not a quality assessment measure. It's about reporting. So you might report that you've not done something. So reporting guideline and quality assessment are two different things. And also, it's not aiming to be prescriptive. It's not aiming to tell you exactly what you must do. It's more just about improving the reporting of what you've done. So obviously, you know, we want to be transparently reporting in the method and structure, and this should, you know, ideally we want to set out everything that we plan to do in the protocol. But very often, as I'm sure you will have discovered, things change when you're doing a review and you find that it wouldn't make much sense to stick doggedly to what you promised in the protocol, and you might have to make changes. And that's why it's important in the final review that you report all these items clearly. So this is the list of the swim reporting guideline and the 9 items that we've included in the items. The items were developed using an online Delphi method and expert and international consensus